The National Council on AIDS, established under the NACA Act, is a statutory meeting held annually where all stakeholders in the national HIV response in Nigeria meet to discuss critical issues. Hello and welcome to this episode of The Last Mile with NACA. I am Adesuwa Osui. The National Agency for the Control of AIDS, NACA, recently concluded the 6th National Council on AIDS meeting with stakeholders in Abuja. The theme of the 2022 edition is Innovative Approaches Towards HIV Epidemic Control and Program Sustainability at State Level. This episode brings you highlights of the event. Keep watching.
The National Council on AIDS holds once every year and serves as a platform where all relevant stakeholders meet to provide technical and policy direction to the national response. The council comprises of NACA board members, patient community, delegates from all states and the Federal Capital Territory agencies for the control of AIDS, and representatives of other stakeholders in the HIV and AIDS response. The 6th edition of NCA, themed Innovative Approaches Towards HIV Epidemic Control and Program Sustainability at State Level, had many dignitaries in attendance, including top government functionaries, representatives of the UN systems, US President's Emergency Plan for AIDS Relief, PEPFAR, ministries, departments and agencies, faith-based organizations, civil society organizations, and other relevant stakeholders. The Director General of the National Agency for the Control of HIV and AIDS, who also serves as the chairman of the council, Dr. Gambo Aliyu, delivered the welcome address.
We're all aware that this is the highest decision-making meeting for HIV. And we're unable to hold this meeting the previous 2 years, obviously because of Corona. Now that that thing has eased up, we are back into business. And I'm happy we are back united. And I also want to let everyone know that there is real light at the end of the tunnel. And the end of HIV transmission is truly near in sight in Nigeria. If we can just continue to maintain this momentum, this current momentum, give us the next 1 year, at most the next 18 months, we'll come back here and we'll have beautiful discussion, on how do we sustain this. Because yesterday I was saying the challenge of controlling HIV begins with epidemic control for a country like Nigeria. When we control the epidemic and we have 2 million people or near that living with HIV, the question is, how do we sustain this individual on life-saving medication for the rest of their life, or for as long as the cure for HIV is found?
There were goodwill messages from partners.
Nigeria has made remarkable progress in the HIV response, with innovations, programs that work, some of which need to be brought to scale or need the policy backing. I hope we will see some of these game changers manifested here over the next 3 days that can lead the country in addressing inequalities that stymie a sustainable response and getting to the last mile in every state and in every locality.
The theme of this 6th National Council AIDS meeting is really welcome and aligned with our objective to develop domestic resources and to work with the countries to sustain the gains already achieved.
The PEPFAR program is proud to be associated with this National AIDS Council meetings. In this 6th iteration, because some of the conversations that have gone on already, we are very excited to hear how stakeholders are thinking about the future of the HIV program in Nigeria. and your thoughts on innovations that need to be brought into the program, especially as we increasingly approach really the targets that we set for epidemic control for ourselves. Very closely tied to those targets are considerations that we must all begin to make around how do we sustain the program, the success we've had so far, and of course sustain the program in the long term.
The next set of speeches were from top government functionaries present.
The Senate Committee acknowledges the very importance of the work that has been done at both the state and national level to bring about the current levels of 1.4% prevalence across the country. We must also therefore acknowledge that a lot more work needs to be done to further bring down this value, especially amongst women and children. We also commit to supporting you in making this happen through appropriate legislation, favorable policy making, and impactful budget appropriation towards the fight against HIV and AIDS.
We at the House of Representatives over the year have continued to provide legislative support for the fight against HIV in the country through various legislative instruments and interventions, and also through provision of budgetary funding for the program of NACA, which has gone long way in laying the foundation for the gains recorded by NACA at the national level. I must commend the Director General of NACA, Gambo Aliyu, and his management for their effort to fight against HIV globally.
I just want to say that I bring the goodwill of the Honorable Minister of Health, Dr. Osagi Ehanire, to this 6th NCA meeting. It's nice for me on a personal level to join NCA for the first time from the side of the health sector, but it's also very nice to see all the colleagues from the various SACAs. I look forward to a very interesting conversation because the discussion is about sustainability. We know that at this point, our next step and conversation must be around sustainability.
Being in the Ministry of Women Affairs, you know very well that we are the strongest partner NACA should have, because not just because of women, but as a mother ministry, we care for all members of the family. And those living with HIV/AIDS are very dear to the Ministry of Women Affairs, and it is our responsibility to stand by NACA at all times to support those living with HIV.
Day 1 ended with a technical session on governance and system strengthening.
We've said over and over, HIV cannot be eliminated until we are successful in terms of finding people that live with the disease in communities, put them on life-saving medication, and keep this virus within them. And the last 3 years have seen tremendous growth in terms of the number of people we find. We found close to 1 million, place them on treatment. That has never been seen, in our history of our national response. So that is why we're bringing everyone together to say, look, united, we're fighting this virus and we're making success. Let us keep this momentum. And let us make sure that we don't get our eyes off the big prize. And what that big prize? Achieving epidemic control and making sure that we stabilize and keep HIV within people that live with it.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
The technical sessions continued on day 2 with presentations and deliberations of various memoranda.
When we're talking about program sustainability or even the epidemic control, we should also be talking about sustainable financing, which has been a major challenge for SACAs across the country. Like in my state, Mr. Governor tries as much as possible to provide funds for HIV response. But across other states, there are some SACAs that do not have budget line. And some have budget line, they don't have approvers. While some have approvers, they don't have releases. So across the states, there are different challenges of financing, that's of sustainable financing for HIV control. And this council is part of what we're looking to solve some of these problems. And a lot of innovative approaches have been presented to us, which we feel we should adopt and implement at the state level and see how we can actually achieve not only the epidemic control, also sustain the epidemic control and actually end the AIDS epidemic or pandemic by the year 2030.
The focus of this council meeting this year has to do with sustainability of the response. We all know in the past most of the response have been donor-driven, so we need to take ownership, and especially at the state level. That is where the work is usually done. So we are encouraging ourselves here as Chief Executive to see how we can include budgetary provision for HIV response in our own budget in the states. Also develop strategic plans that are smart towards addressing the HIV response at our state level. Of course, collectively, whatever we do at the state level, that is going to be a bureau at the national level. So for us as a state, we have inaugurated the resource mobilization technical working group, and it's multi-sectoral under the leadership of the Director General of NACA. So that technical working group starts with the mandate of looking inwards and outwards on how we can start mobilizing resources, how can we start forecasting, and how we can get resources to ensure we have effective coordination of the response in Taraba State.
HIV response at the state level since after the World Bank HPDP2 ended has been a challenge. And then there was that fear. How do we sustain the gain that we have secured? So coming up with this, I think it's a well thought out thing. We're actually moving towards epidemic control by 2030. A lot of milestones have been covered. But the challenge is, how do we sustain it? So bringing people to deliberate and then taking it to the council level where certain recommendations could be made and certain policy could be approved to help sustainability, I think is the right thing to do. And I believe that at the end of this National Council of meeting, a lot of things would change, particularly concerning sustainability at the state level.
My presentation is based on the management of HIV/AIDS in Nigeria Correctional Service. Every organization has their own way of management, and the management of HIV/AIDS in Nigeria Correctional Service, we do it in collaboration with Federal Ministry of Health, NACA in particular, then UNODC. They collaborate. This collaboration has given us a lot of strength in managing the image because they support a lot in terms of clinical materials, not only in HIV/AIDS management, but other related diseases from HIV/AIDS. So that makes our work easy.
Day 3 opened with remarks from the Director General of NACA.
Today's session is the last session of the National Council of AIDS, and it's the most critical session where the proceedings of the previous 2 days will now be considered and adopted. And at the same time, input that have been provided also will also be looked at, and a decision on the next National AIDS Council and important proceedings that have taken place of the last National Aid Council and those that have been adopted and implemented will also be looked at.
There were several goodwill messages, including that of the chairman, NACA Governing Board, and representatives of the Secretary to the Government of the Federation and UN systems.
I commend the leadership of the National Agency for the Control of HIV/AIDS, NACA, for their consistency in the fight against the HIV scourge in this country. The federal government is committed to improving the health of Nigerians. I will continue to work with partners to support the HIV/AIDS response in Nigeria. I am particularly glad to note that governments at subnational levels are variously evolving and exploring innovative approaches towards sustainable health financing, including health insurance. May I assure you once again of government's full commitment to providing an enabling environment for effective implementation of policies and strategies aimed at epidemic control and sustainable HIV/AIDS response for the country.
Since the discovery of HIV in Nigeria in 1986, the response has been largely donor-driven, with major support coming from international partners. But however, with the current economic challenges, this support is dwindling. I want to commend the government of President Muhammadu Buhari, GCFR, for stepping up federal government support by funding treatment for an additional 3,000 clients every year since 2020. I appreciate the initiative taken by the Nigerian private sector in establishing the HIV Trust Fund in Nigeria. I hereby urge all state governments to follow suit by ensuring adequate budgetary allocation and releases to their state agencies for the control of HIV and AIDS. I congratulate the Director General of NACA, his management team, and the entire staff of the agency for holding the 6th National Council on HIV and AIDS.
The past 2 days have been very insightful, listening to organizations share ideas for implementing sustainable programs and improving the strategy and policy environment of the HIV response. Nigeria has a success story to tell. The HIV epidemic of 10 or even 5 years ago is not the same one we have today. It is on this note that I want to encourage all of us who are in this push to see epidemic control. Specifically, I want to encourage all those persons, the organizations that submitted memos, to keep pushing for the changes that can take the response to the next level. Let us continue to work together as a powerful coalition to ensure that when next we gather in this setting, we will be talking about how Nigeria got HIV under control and is sustaining the response. A big thank you to NACA and partners who convened this 6th sitting of the NCA, and rest assured that the UN Joint Program with its 11 co-sponsors hopes to see this through with you. We are together.
The Director, Community Prevention and Care Service of NACA, Pharmacist Alex Ogudigbe, gave a summary of presentations at the technical sessions.
We had 3 sessions, technical sessions, and 72 memos were considered. The first memo that was considered was by the Director General of NACA, which was on the 5th National Council on AIDS and its update and its resolution. 41 of the 72 memos are being sent to this council for notation only. Only 11 memos are coming in for consideration for approval of certain prayers therein concerned. 6 of the memos received were stepped down. 1 was asked to be represented next year. 8 of the memos were withdrawn, either withdrawn or disclaimed. And of 4 memos, we did not see the people who sent them in. They were absent, so they couldn't present it, and council could not, technical council could not consider it.
The presentation of council resolutions and communique was made by Dr. Funke Oki, Director, Policy, Planning and Coordination, NACA.
We're interested in what happens at state level because all the implementation takes place at state level. At national level, we're just concerned with policies, guidelines, coming out with new strategies, but implementation is at state level. And at that level, they've been having some challenges. So we're trying to ensure that the states are able to implement programs at that level and at the local government level, because at the end of the day, those are the sustainable structures. The donors will finally go. The partners will reduce whatever they're doing at some point in time, but the government will always be there. That's why we're interested in the sustainability of our programs.
Deliberations at the 3-day National Council on AIDS meeting was highly fruitful, with resolutions that will further intensify approaches to the national response.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Only together can we fight AIDS to finish, and Nigeria, through the leadership of NACA, is poised to achieving the global target of ending AIDS by 2030. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesua. See you. Goodbye.